Welcome back to another episode of Quick Hits. I'm your host, Tyler Smith, joined as always by Ken Booth. Today, we're joined by J.D. Whitlock, Chief Information Officer at Dayton Children's Hospital, to talk about what makes pediatric healthcare so uniquely complex, collaborative, and full of opportunity. J.D. shares his journey from serving as a healthcare administrator in the U.S. Air Force to leading IT strategy for one of Ohio's top pediatric systems. He offers an inside look at how Dayton Children's is using technology, from Epic to AI-powered digital scribes and chatbots, to enhance provider workflows, protect patient privacy, and improve the experience for families. You'll also hear JD's perspective on the future of AI in pediatrics, the evolution of interoperability, and why collaboration across children's hospitals nationwide is key to driving innovation. His view on leadership, governance, and maintaining focus amid rapid change is invaluable for any healthcare IT leader. Let's jump in.
Welcome to another episode of Quick Hits. I'm your host, Ken Booth, joined as always by Tyler Smith. Tyler, how are you today?
Doing fantastic, Ken.
Glad to hear it. We've got a great guest today. We've got J.D. Whitlock. He's the CIO at Dayton Children's. J.D., welcome to the show.
Thanks. Glad to be here.
Yeah, we're really excited to chat with you. We've definitely seen that you've had an impressive career in healthcare IT, and we love talking to a CIO who's doing something unique and definitely making an impact. So I thought we'd just kind of start with your journey and talk a little bit about, ultimately what brought you to Dayton Children's as the CIO. How'd you get here?
Sure. So I've been in healthcare for 30 years now, starting out in some operational management roles. And then slided into IT management roles about 20 years ago. And then I'm a retired Air Force healthcare administrator. And 7 years ago, I joined Dayton Children's as Chief Information Officer. Dayton Children's is a small pediatric health system, 4,500 employees, 200-bed hospital, small integrated delivery network, $800 million revenue. We're on Epic, which probably will play into this conversation at some point.
Probably.
That's the short version.
Excellent. Well, you mentioned you're at a pediatric hospital, and certainly we know that children's hospitals face such unique challenges, especially when you compare it to the adult health systems. So, what makes the pediatric environment distinct when it comes to the IT strategy, and how do you innovate in that environment?
Yeah, it can be a challenge sometimes simply because if you are going to start a digital health company and build something, you are probably going to build where most of the money is in adult medicine first. And so oftentimes pediatrics is the second fiddle, redheaded stepchild, pick your analogy. So that can be a challenge. And then in other cases, of course, there are a lot of things, in particular in Epic world, where, revenue cycle or, it's all the same, right? Sometimes it's not that much different. So it just depends what it is. And we have a, super tight collaborative environment. And of course, in healthcare in general, we have that. But I think it's even maybe a little bit tighter in pediatrics, maybe because of that. So all the children's hospital CIOs are tight, and we get together and chat, and who's doing what and what's working for who, and that's a good way of finding out what is working out there on the pediatric side. I was just talking to one of our radiologists. There's a lot going on in imaging with AI right now, but that's a good example of people are developing for adult medicine first. And so there was actually only a few tools that were really relevant to. There's a couple bone age tools we were looking at that was relevant for pediatrics. So sometimes you just have to get used to being a couple years behind where the adult medicine innovations are. And also there are some pediatric digital health innovation dedicated groups out there. There's a group called Kids X, which is run out of Children's Hospital Los Angeles. We've been a member of that for 5 years, and we see it's sort of like a accelerator program. So they go out and find innovative pediatric digital tech and bring it in, and we do a little Shark Tank thing and find the best vendors out there, and sometimes very compelling stories, about, the founder was, experienced something bad with their kid and they started a company to try to do better,
Right.
So it all comes together in those ways and others. And it's just a blessing to be a part of this type of work, just once again, in healthcare in general, and even especially in pediatric care. It's just a special place to be.
JD, it's really interesting when you talk about the information sharing and the almost collegial environment. It seems like the pediatric hospitals have across, state lines, like long state lines, like Los Angeles to Ohio. A trend we see in adult is M&A, and a lot of the big systems, particularly in specific regions, will acquire other systems. But then we're also seeing it across state lines, with Atrium, Advocate, and wondering if does the conversation of M&A and combining children's hospitals on a more national basis ever come up? And then, if it does or doesn't, just curious to your opinions.
Yeah. So one thing is you can have, with some exceptions, actually, Ohio. I mean, we're an hour's drive away from two of the top 10 children's hospitals, in Cincinnati and Columbus. And so, actually, in a sense, we're an exception to what I'm about to say. But in a lot of cases across the country, you've got the children's hospitals are covering some pretty wide geographic areas, and there's not always a whole lot of direct competition. Unlike in a typical, medium or larger size city, you've got a couple adult systems that are in fierce competition for the same people in the same zip codes, right?
Sure.
And so, having said that, there is a little bit of M&A. There just recently, Rady Children's in San Diego and Chalk Children's Hospital of Orange County are merging, and of course they're neighbors geographically. I don't know all the details about the reasons that was a mutually advantageous thing, but so it does happen a little bit.
Yeah, very, very good. And I believe we will have someone from those organizations on Quick Hit soon. So great to get a little bit of a kind of preview clip. And then, we've also had the pleasure of talking to Nita Brown from Cincinnati Children. So really cool to continue the conversations around pediatrics. And that makes a lot of sense now that you explain it with, there's not as much of an arms race to get the patients. And so there's security in the kind of populations that you serve. So we probably won't talk as much about data migration today as we talk about sometimes.
Yeah, they'll do some of that. Our version of an acquisition is primary care practice, but we have been doing that in recent years, and that's still a data migration exercise to get them onboarded into Epic in a user-friendly way as we possibly can, and bringing in archiving where appropriate, and then migrating it over, appropriate data into Epic for a good go live.
Yeah, excellent. So, do you feel you have to approach the chatbot a little bit different in a pediatric environment? You're dealing with parents, obviously,
Right.
But does that change the way you roll out technology? Do you have to educate a little bit differently?
It does, and certainly. So in several ways. So first of all, you're right. The complexity of the relationship between the actual patient and there's the financial guarantor, of course, in healthcare we have to worry about, and then there's the proxy. And you can get, not uncommonly, you can have complex situations like a dad is the guarantor and provider of insurance, but there's been a nasty divorce, and dad does not have parental rights. And oh, by the way, it's grandma that's bringing the kid to the appointment, and whose phone number do we actually have registered in Epic for what? You do have to get into those, and sometimes Epic comes out with great new e-check-in functionality, whatever, and it can be challenging. And in the pediatric space. So yes, those kind of things do have to be thought about carefully and implemented differently sometimes.
Yeah. So then the follow up question to that, because that's actually was kind of the next question we had when it comes to security and privacy. Obviously, that's our top of mind. How do you balance that innovation while maintaining that trust and protecting sensitive information? How, especially in complex situations like you described, what's the approach there?
Yeah, it's can be very challenging. Another factor is that different states have different laws about when a minor can kick mom and dad out of their MyChart.
Oh,
um, and so then we have to handle that differently. And how proactive are we being? Should we be when that adolescent that is not yet old enough to drive themselves to their appointment, but is getting care, perhaps needing to talk to a sexually active 15-year-old,
mm,
that really has a need for privacy. And so how can we set up the MyChart so that the 15-year-old gets all their information to MyChart? Mom and dad know when the appointment is because they got to drive their kid, but don't necessarily see all of the the whole note for some sensitive topics, right?
yeah.
So yes, that gets very, very complex.
It's really interesting talking about the limitations of children in terms of logistical capabilities, or maybe even decision making. But it also brings up the idea of around they are typically extremely informed and capable users of technology, and so I wonder, like, are there trends that you see, and maybe it's more once they're allowed to use technology. I don't know if it's 13 or not having any children myself, but I know that children's use of technology is a huge hot button topic. But are there areas where, like, you all get some insight, maybe around MyChart, or around how the children patient or representative are using technology that might be helpful for the broader adult community in terms of maybe something down the line of a trend that you see and you think will maybe speedball?
Yeah, what that makes me think of, one trend that happened was, so back to that 15-year-old, a responsible pediatrician asks some proactive questions at that age. Are you sexually active? And often mom or dad brought the 15-year-old to the medical office in person. And what the pediatrician says is, Mom, Dad, please go out into the waiting room. I'm going to have a private conversation with your child. And in the era of COVID and increased telemedicine, what sometimes happens is the provider, doing a video visit with a 15-year-old, and mom's out of frame, but mom's actually listening from the next room. Right. So there's all, and how do you handle that from once again, advising the 15-year-old on their legal rights. At the same time, they can't drive themselves to the appointment. Right. So all of that gets a little hairy sometimes.
Certainly some fun conversations there, I'm sure. It's certainly an evolving landscape, especially as we look at technology's role and it kind of gets us sort of into the AI discussion. Everybody obviously talking about AI. You've already brought it up. Where do you see meaningful opportunities for a children's hospital, or at least some emergent technologies when it comes to pediatrics?
Sure. So of course I mentioned the ambient scribes that we're using, a conversational chatbot on the website. That there are pediatric-specific subtleties in there. Our ambient vendor, Bridge, put in a feature where when a pediatrician is doing a visit, the AI will recognize if it's a well child visit. Well child visits have to be documented in a certain way. They're very important for quality outcomes. All pediatric organizations are judged on whether we get our patients in for all the well child visits in the prescribed periodicity, which is just good pediatric care. And so the AI will say, oh, this is a well child visit. Therefore, when I draft the note for the provider and put it back into Epic 30 seconds after the encounter is done, I need to format it this way instead of this way because it's a child visit. So there definitely are pediatric specific components of that, but the other 98% of that is a well implemented digital scribe that's well integrated with EHR and properly supported and trained and all that kind of stuff.
Let's take a quick break. At Health Data Movers, we know that data migration isn't just about moving information from point A to point B. It's about making sure your clinical and operational data is accurate, accessible, and secure, so your teams can focus on delivering care, not chasing records. Whether you're consolidating systems, switching EHRs, or sunsetting legacy data platforms, our data migration experts help you move confidently through complex transitions. We bring proven tools, repeatable processes, and deep healthcare experience to make your migration seamless. If you're planning a system change or even thinking about one, let's talk. You can learn more at healthdatamovers.com. Now back to the show.
So when we talk about AI, and we talked about Epic at the beginning, a lot of the sentiment that I feel like is coming across is like we are at this paradigm shift, and it's helped me reflect a little bit on, and you've been in the business 30 years, so I've only got half of the amount of time you have had, JD, but until when I started, it was essentially the dawn of the enterprise era from a best of breed preceding era. So, meaningful use, Epic, Cerner became the main players. And I don't know, it seems like there hasn't been any real paradigm shifting events for the past decade plus. But now with AI, I think I've heard that even companies like a Bridge or other ambients are sort of also developing like a mini EHR. And so it seems like, and then also data has become way more a center of conversation over who owns the data, who gets to do what with the data. And so with like technology evolving again, data concerns, it seems like we might be at a paradigm shift. And I don't know if that means it will go back to like a best of breed world because we know Epic has art coming out. But just wondering if you're feeling that sentiment or if not, and kind of how you see the next 10 years evolving, maybe looking at it from a lens of like enterprise, best of breed, or kind of just like how the stack may change.
Yeah, a couple thoughts there. First of all, I would say that we really have done in the last 5 years, interoperability has gotten like fabulously better, right? With fire standards and with the government telling us we will use certain standards, the good kind of government regulation when actually enforce some standards, right? Okay. Back in the dark ages, 10 years ago, you'd find something innovative, and you'd say, oh, okay, we're going to buy this for our health systems, and oh, by the way, it has to integrate with Epic. And then you would have our interface team and the vendor's interface team sit down and piece together some custom HL sub, and you spend more effort on the interface than you did on the spending the money for the SaaS or anything else, right?
Yeah.
And sometimes you got truly burned where you found out this doesn't really work and the interface doesn't really work, right? And so fast forward to today. As an Epic customer, I can look on the Epic App Store and see that this interface is basically blessed by Epic as working. Does not mean that Epic is saying you should buy this tool because it may or may not be a good fit for you, right? But Epic is saying yes, this works, and I can actually look in and see what other Epic customers are live with it and installing with it. And so that happens sort of slowly, but it is really a transformative capability because let's say you come up with a really good idea, the generative AI really can do something, make some little part of your healthcare journey better. And you can go to the major player EHR, all of whom have mature app stores. If they don't, then they're not really a major player EHR anymore, right? Mm-hmm. And you can design to those, and those, of course, there's companies that's all they do is they work with digital health innovators and their expertise is knowing how to integrate with the EHR. So that whole ecosystem there has gotten fantastically better. So that's a source of a lot of innovation, or maybe that is just commercially feasible now that wasn't before. So that's thought number one. We have come a long way there. Thought number two is when people say, often on LinkedIn, I read these opinions that AI is just going to replace the EHR. I basically write that person off as not understanding anything about the complexity of healthcare.
Right.
It's good
That's
to
just
know.
not how this is not how it works. Now, as a happy Epic customer, I still want Oracle to be successful because I want Epic to have some competition, right? But stating that we're just redesigning everything from the ground up, and that Epic is legacy technology, as certain people at Oracle like to post on LinkedIn, my response to that is show me the first health system of any size that is actually running on your spectacular new built from the ground up cloud platform, because I think that's 5 or 10 years off. So there are my thoughts there.
Yeah, no, it's really helpful, and I appreciate kind of your willingness to think of it two ways, because at one you're saying you're a happy Epic customer, which I oh, well, I'm probably biased, but I find that most customers who actually use Epic are happy. A lot of the people who see the disgruntled or maybe at other companies, and I've never understood the throwing mud approach, but maybe it gets clicks in the digital era. But I also like how you're saying the interoperability is improved, and so were you to maybe not even just move EHRs, but maybe there's functionality that Epic might provide, but maybe you see an app store or Epic app, or I can't even remember what it's called now, but whatever that database is of companies like that exists. So that then pushes Epic to either improve their offering, but it makes sure that customer need it's not like, for lack of a better example, it's not like the airlines where like we only have really the major players. Another one comes across every once in a while, but they're not really that threatening. And the interoperability now makes it that like, yeah, a bridge like ambient, it seemed like everyone knew that was the problem that needed to be solved. The proverbial picture of the child Drew of the physician looking at the computer screen has been talked about forever. And obviously it would be, well, if we remove this screen interface, it's voice. And ambient came along. They essentially, or bridge came along, and I guess also ambient, and then Dragon Copilot, and now Epic is also going to add the ability to have that functionality. But it does feel like capitalism, not like a planned economy approach.
Exactly. By the way, it's Epic Showroom is the new name.
That's right. Thank you. Yes, for the next year, right? But it may change.
It's gone through so many iterations.
I look at it probably once every other day, and I still want to say Epic App Orchard.
Yeah.
One of the very few things I would criticize Epic for is they can't figure out what they want to call their.
Yeah.
But you're right. So back to ambient. Here's what is true. Ambient, just because of the way that the workflow goes, the provider's workflow, is a very natural place to inject revenue cycle innovation, clinical decision support innovation. So a bridge is partnering with UpToDate. I'm promised that's coming in the next several months here. That's going to be powerful to just sort of inject, up-to-date guidance, sort of as the notes coming in, as the notes being written, revenue cycle. So where you can say, for example, to make sure we get the E&M coding right for professional billing, hey, the AI heard that the patient laundry listed their 17 diagnoses, but you didn't actually evaluate and treat 17 of those. You just evaluated and treated 2 of those. And we need to make sure we document for the 2, not the 17. Yep. And oh, by the way, can you help us make sure that we're actually, putting the right things in the note? The provider would much rather be interrupted when that AI generated note is coming into the chart. They would much rather be interrupted by 1 or 2 questions about, oh, by the way, how should we, this is the suggested billing for this. Does this make sense? As opposed to not being interrupted then, but then being interrupted days later by the billing analysts, by the coding, by the CDI people. Hey,
Mm-hmm.
what did you mean by this? Right? They really don't like that, understandably. And as every single physician will tell you, I did not go to medical school to be a coder, right? So
Right.
there's lots of ways where ambient really naturally fits into some revenue cycle management efficiencies that all doctors are looking forward to. And if you talk to the ambient vendors, I saw a post from one of the NABLA execs. They said their customers are very happy, but what their customers press them on is not price. They press them on how fast can you get all this revenue cycle integration in, because that's what
Hmm.
that's what we most want next.
You kind of hit on a good point there. You talk about getting that buy-in, or what the doctors or clinicians prefer, their preferred workflow. So how do you kind of establish that partnership? Because anytime you're going to introduce something new, obviously you want to make sure that you have their buy-in. You want to make sure that it's technologically feasible. What's your process? Like, do you guys have regular work groups, or how do you make sure that you have a good, strong collaborative effort across all the teams there?
Yeah, sure. So governance is vitally important, right? Theory of constraints, the most useful thing I learned in business school, right? So you only go as fast as your constraint in the pipeline, right? If you're running an Epic shop, you have certain teams of people that are certified to do certain things, and if you come up with 10 projects to do at the same time, and they all have to crunch through the same team at the same time, it's not going to work. You have to figure that all out. If you set up a separate AI committee, which is the style these days, and they come up with a list of things you wanted of new AI, of the Epic AI tool, because Epic's got they're rolling out 100 AI tools,
Mm-hmm.
right? They're
Mm-hmm.
basically Epic's throwing things at us faster than we can keep up with, and we have to be judicious about which ones we do first, and all that. And so that new AI thing is actually competing with the priority, as it should, against building that new revenue producing clinic, right? Just because the AI thing is a little sexier than the new clinic makes money. The AI thing doesn't actually make money. It just makes the doctor's life 1 minute better every day,
Right.
right?
Right.
So you got to be very careful about that. And really, it's good old fashioned smart governance and understanding the opportunity cost and what you lose when you choose and how much money you actually have and what the real ROI is versus what the vendor said the ROI was, which is good governance, like it's always been.
Yeah. So you won't be giving that over to AI anytime soon to make those decisions for you, huh?
No, I will
No,
not.
not quite. We want to talk about what's next on the horizon for Dayton Children's. Any big initiatives or priorities or even strategic goals that you guys are excited about over the next few years?
One thing that I am excited about, this is rather pedestrian for a lot of larger health systems, but I mentioned that we've been doing primary care acquisitions. We had not previously done a lot of primary care because we did not want to compete with our local pediatricians.
Hmm.
I won't go into all the reasons why that changed. Mostly because a lot of them wanted their practices to be acquired once they were retiring. What that now gives us the opportunity, it used to be if you had a generally healthy kid, you maybe never came to Dayton Children's, or you came to your Dayton Children's when your kid ran their tree into a bicycle and broke their arm, right?
Sure.
And so you had an episode, and maybe you had a MyChart because you came to our emergency room one time, you needed surgery one time, right? Um, which is not a big motivator to even be on MyChart in the first place, right? Specialty hospital at the end of the day, right? Now we can say, hey, congratulations, you're having a baby in Dayton, Ohio, and come to one of our PCPs. And now all of your child's records will be in MyChart, and we just have a great continuum of care. And when your pediatricians, your Dayton Children's pediatrician's office closes, we have some great urgent care. And if you really need it, we have the emergency room, and we get all the acute care. When you need it, it's all in one place. And how do we use all the great new, better patient-facing tools that Epic's rolling out in the AI? You may have heard their new naming for the AI tools, right? The ART for the clinician facing, Penny for the revenue cycle side, and Emmy for the patient facing side. Like, what does that? If you can implement that well for the entire continuum of care, That's very exciting from a population health management, and we have a large ACO. All our Medicaid patients are in ACO. So that's exciting to me, even though it's not particularly groundbreaking innovation. I think that when it comes to other generative AI tools, we will do those. So the examples I gave, the ambient, right? If you're not doing ambient, you won't be able to recruit physicians soon, right?
Right.
And then chatbots, people just sort of assume that these days they can uh, they can get a good chat. If you go on a website, you want a chatbot that can cut through the normal search experience on the website, right? And in our case, it's really using the content from our website and also a healthcare 100% healthcare trained LLM in the background to answer things appropriately, right?
Gotcha.
So that's just a better experience. People just sort of start to expect. So I think we absolutely have to keep up with just what the technology can easily do and what people have expectations of. The classic. Everyone likes to say, "Oh, I can do this thing for my bank. How come I can't do it for my doctor?" Right?
Mm-hmm.
And 70% of the time, that's a very valid criticism, and we need to do better. 30% of the time, we say, well, you know what? Turns out neurosurgery is a little more complex than changing your account. So,
Right. Then ordering a new debit card. Yeah, absolutely.
yeah.
Well, JD, thank you so much for your time. We just kind of have one final question. It sounds like you're, clearly from the conversation, you guys are doing some amazing things at Dayton Children's. For other CIOs or other IT leaders that are working in healthcare, especially those considering even the pediatric space, what advice would you like to share? What can help them and kind of inspire them for this environment?
I just keep going back to the collaboration, and I'm in so many different collaborative groups, whether it's the Children's Hospital group I mentioned earlier, or just all the Epic CIOs get on calls and talk. I'm in a regional group, and so just finding those opportunities. I do find that there are health systems CIOs that are very visible in those collaborative groups, and there are those that are not. I'm guessing the ones that are not is because they're putting out fires or they're doing other things that they feel that they don't have time to join those collaborative groups. I can't imagine doing my job without learning from everybody else what everybody else is doing, so that I'm hopefully putting out fewer fires. So I guess that's what pops to mind first. Make time for those collaborative groups.
Excellent. Well, again, JD, thank you so much for taking a few minutes to talk to Tyler and I. Really enjoyed the conversation. We just wish you continued success as Dayton Children's continues to grow.
Great. I really enjoyed our chat. Thanks.
Thanks again for listening to Quick Hits, a healthcare technology podcast for healthcare technology professionals. Follow us on Spotify or Apple Podcasts, and don't forget to reach out to us with feedback, suggestions, or even people in the healthcare technology industry you think we should interview. Send an email to quickhits@healthdatamovers.com.